Today, we're going to talk about CBD and how it relates to bone growth and healthy bones and diseases that can be caused by a lack of bone density, such as osteoporosis. And the best person to address this topic is our favorite chiropractor and our CBD doctor, Dr. Frank Michalski. So, good morning.
Good morning, Stacey. Thank you for having me.
Absolutely. Well, obviously, this is your area of expertise. So let's talk about what the research says, in particular, when we talk about osteoporosis. So we obviously need to understand what osteoporosis is and how CBD is showing great promise in helping people with that condition.
Of course. So, yeah, when it comes to talking about bone growth and osteoporosis, I kind of split this up into two topics for everyone. The first one being low bone density. So, for those listening or those watching who don't know what osteoporosis or osteopenia is, this is a diagnosis of decreased bone density. So, what I like to explain to people is if you could picture a bone inside your body, chances are you're picturing a very hard, very sturdy structure. The reality is the density, the thickness of your bones is constantly changing. These are living organs. These are living tissues that are innervated by blood vessels and stem cells. So our bone density is constantly changing. That is the durability. The density of our bones is constantly fluctuating day to day. Now you can think of your human body as a bank. For example, when you're younger, you have cells in your body called osteoblasts. These cells are depositing new bone into your body every day, making your bones stronger. You have another type of cell called osteoclasts. These cells are withdrawing bone from the body, decreasing bone density. Now, when we're discussing CBD and osteoporosis, it's important to understand that these osteoblasts, these are the cells that are depositing new bone, they have cannabinoid 2 receptors on them, CB2 receptors. There's also CB1 receptors present as well. So when we look at CBD oil and we look at the endocannabinoid system, research is starting to show that our endocannabinoid system plays a large role in regulating the system of deposits and withdrawals on our bone growth. Let me give you an example that explains this. And this is really where the foundation for this research came up. We may have discussed this once before. So what they noticed is with women who enter early onset menopause, they are at more of a risk of developing osteoporosis and osteopenia. They've also noticed that younger teenage girls who are anorexic, right? They may permanently lose their periods, forcing themselves into an early onset of what is essentially menopause. And what they found is women, when they enter menopause, or these anorexic females, they have low bone density. They have osteoporosis, osteopenia. But what they also found was that these women had lower levels of circulating cannabinoids in their body and decreased endocannabinoid system functioning. So the theory is, okay, if we give someone CBD oil, we know that it's going to block that enzyme that destroys your body's own cannabinoids. It's going to raise your body's own cannabinoids. And when we stimulate our own endocannabinoid system, what we're seeing in these women who are past the age of menopause and these younger anorexic adults is that it seems to stimulate bone growth, or at least right now, that's the working hypothesis. That's the direction that all the research is going. So that's really where a bulk of our information comes from on osteoporosis. We know that women who enter menopause have decreased estrogen levels. Estrogen goes down. It's a hormone that protects our bones and promotes bone growth. We know the same is true for women who are anorexic. Estrogen levels decrease. They have decreased bone density. The toughness of their bones is decreased. When we see that return to endocannabinoid function, there would appear to be a strong correlation to increased bone density. Now, when we talk about bone fractures, we'll discuss the research a little bit more. But I can tell you from my own end, it was a very ironic story. I was actually diagnosed coincidentally with osteoporosis, which later turned into osteopenia about 4 or 5 years ago. And I can tell you, since I had a T-score, which is what measures your bone density, of a negative 2.6. So that's osteoporosis in the hip and the spine. Sure enough, I eventually, with lifestyle change, I believe CBD was a huge part. I was able to bring that up to a positive 1. It should be higher, but that was quite a jump. So I certainly am a believer in it. That's my own personal little testimonial on it. But I see this every day changing in the research. And we have patients too who have come in and said, hey, my DEXA scan has improved. Now it's important to remember we're changing other things with these individuals as well. But I do believe that the CBD certainly plays a large role in that. And we're starting to see that in the preliminary research.
Can you explain, so that we're clear, the difference between osteoporosis and osteopenia? Is that what you called it?
Yeah, of course. So it's actually measured when you go to get a DEXA scan, which is an X-ray image that measures the density of your bones, the rate at which those images pass through your bones. That's what gives you a score, and it's called a T-score. If you have a T-score of a negative 2.6 or greater, that's osteoporosis. So that means your bones are really lacking density. They've become very almost brittle. They've become very, very brittle. This is where you see someone fall and they fracture a hip. This is where you see someone fracture a vertebrae, usually an elderly lady, fracture a vertebrae in their thoracic spine. That's osteoporosis. Osteopenia is the beginning stages of osteoporosis. So this is where we're starting to say, hey, this is where your physician tells you, listen, you're headed the direction of osteoporosis. Right now, your bones have become osteopenic. They're starting to become more brittle, but they're not fully diagnosed at this point as osteoporosis. So think of osteopenia as the pre-setting to osteoporosis.
Okay, that's very clear. So do you think, based on your own experience and the research that you've done, that CBD can actually prevent or maybe push off this disease if you're prone to it? Or I should say, and do you think it can actually help make your bones stronger and actually help your body rebuild some bone that has been lost?
So I found myself asking the same question, and I think we will be able to answer some of those when we talk about the fracture and the healing properties that we see from CBD when it comes to bone fractures. But I will say this, as far as prevention goes, I would like to believe yes. And the reason being is, if we look at the root cause of osteoporosis or osteopenia, a lot of it has to do with our hormones. In men, it has to do with a decrease in testosterone. In women, it has to do with the sharp decrease in estrogen. We know that CBD can help to balance and regulate hormones. We've discussed this in previous podcasts that me and you have done. So from my point of view, yes, if we can support healthy hormonal function, in turn, shouldn't we be able to possibly prevent or offset or slow down the progression of osteoporosis or osteopenia? Logically, the answer would be yes, in my opinion. The answer would be yes. Now, the cause of osteoporosis or osteopenia has to be considered too. Again, it can happen with aging. It can happen with other autoimmune disorders, other metabolic disorders. It can happen from repeat chemotherapy and radiation therapies, which we know CBD has been shown to help with that too. So from a bunch of different angles, I think depending on why you were diagnosed, where you currently stand, and again, your lifestyle, CBD might help. Let me give you an example. So one of the biggest risk factors for osteoporosis or osteopenia is tobacco usage. Nicotine, smoking tobacco, it actually ruins the blood vessels in your bones. So it decreases their ability to release the nutrients that your bones need to grow and heal. That's why a surgeon usually won't do surgery on someone who's a smoker, because their healing process is so much less likely. Now, if we use CBD oil to help us quit smoking or quit using tobacco, we're already improving our bone density. And then on top of it, we're going to get the added effect of the balancing the hormones and some of this other stuff I'm going to dive into when we switch over to fractures and the study on fractures. So the answer is yes. I think there's potential for prevention. And I think down the line, I cannot legally say for treatment, but I wouldn't be surprised if down the line we see claims about CBD for the prevention and potentially treatment of these conditions.
Well, you know, the go-to for many people is calcium. That, you know, you can take a supplement for calcium. Of course, you can get calcium from your foods and then dairy. But it's interesting because if we could use CBD, which is proving to help with so many other things, you know, balancing your system. It's such a healthy supplement on so many levels. You know, it really makes you wonder if we're going to see a switch where physicians are going to start recommending CBD. You know, calcium obviously is something that we want to be consuming, though, not necessarily taking as a supplement, where CBD is something that we want to be consuming for a number of positive reactions.
I think what you said is so well put, because we ran into years ago a problem with calcium when it came to bone formation, right? So bones consist of calcium and collagen and a bunch of other things. And one of the big problems with calcium is everyone got on this bandwagon of let's take calcium, let's take supplements. Well, let's eat more dairy. Well, we found out, okay, the calcium from dairy really is poorly absorbed. That's not an absorbable form of calcium, right? And we saw this because people are eating more dairy, they're taking more supplements, but they're just winding up with hypercalcemia in their blood, which means the calcium's in their blood, it's not getting absorbed into the bones. So nowadays you see this big backtrack of whoa, calcium may not be the answer. And to your point, I'm thinking we're going to wind up with a much better answer when it comes to CBD, because the calcium they found, it was causing heart damage, it was causing kidney problems, it was giving people false positive diagnoses of certain cancers due to elevated calcium levels in the blood. CBD, right now, we're not having those issues. In fact, we're seeing benefit in many of the areas that calcium supplementation was causing issues. So I could not agree more with you on that.
Well, I think the research is very positive in terms of helping people with conditions such as osteoporosis. I mean, it's so common. You had mentioned earlier that 1 in 3 women have
One
osteoporosis.
in three, yes.
And then men, we don't often think of men having osteoporosis, but it's very common in men as well.
It is very common in men, and we don't think of it because it's not a standardized test for men. I'm not recommending that it should be, but it's not something that we expect to see, so it's not something that's tested. But I believe it's 1 in 3 women, 1 in 5 men over the age of 50. And the bigger risk is it's not just having necessarily low bone density, it's the risk of fracture that increases when it comes to this, right? This is where you see the person fall, fracture a hip, go into the hospital, they wind up with pneumonia, and this just becomes some long drawn out recovery process if recovery happens. So again, osteoporosis, osteopenia can be very serious, and 15 million, I think it is, worldwide suffer from this or are diagnosed with it every year. So it's a large number of individuals.
Absolutely.
I'm sorry, it's way more than that. It's 200 million. 15 million a year will suffer a break. That's what it is.
I see. Well, let's talk about a break. So we've talked about how CBD may assist people who are at risk for osteoporosis or currently have osteoporosis. But let's talk about it on the flip side, which is common, right? People falling and breaking a bone. How can CBD help them?
Absolutely. So what we have to consider, and where I'll preface it, is when you fall and you break a bone, there's a few things that have to happen. So the bone breaks, your body's going to send blood to the area. It's going to start to form a callus, a hard structure over where that break is. And initially, inflammation is going to occur. And when inflammation initially occurs, this is a good thing because your body's going to send healing properties, healing cells, healing blood flow to that area where the break is. So we break a bone and your body already starts to remodel that area after, day one, okay? So it's important to understand that. Now, when it comes to healing a bone, earlier I mentioned osteoblasts. These are cells in our bones that release an enzyme, and the name of that enzyme is lysyl hydroxylase, okay? Lysyl hydroxylase. This enzyme promotes collagen production. So our bones contain osteoblasts. We know that the endocannabinoid system has an influence on those. and osteoblasts release an enzyme that promotes collagen, which is the protein that we need for our bones to heal. This is important because of the study that I'm about to explain. So a study was carried out in Israel. Israel right now is the area where all of our research is coming from because they don't have the regulations on cannabis that we do here in the United States. In this study, they took rats. So they used rats as the test subject. And let me tell you about this study. They had 18 scientists overseeing the study with 3 different universities. This was an excellent, a very well done study. So these rats had femur fractures. So this would be representing your hip bone, okay? So these rats had femur fractures. And they separated these rats into 3 groups, A, B, and C. Now, group A, the rats were given an injection containing both THC or CBD. So group A, THC or CBD. Group B, the rats were given an injection of equal parts THC and CBD. Group C, they actually took these osteoblast cells out of the rats and directly infused the cells with THC or CBD to see the direct impact on these cells, okay? So we have rats and we have 3 groups. Group A were given THC or CBD. Group B were given equal parts of both. And Group C was an experiment of injecting CBD and THC directly into the cells. Now, the other thing that they wanted to measure was three parts. Callus formation, okay, part 1. Creation of collagen cross bridges, part 2. And osteoblast cell proliferation, so the function of these osteoblast cells. And they used X-ray imaging to measure the density. They tried to re-break the bones to measure the strength of the bones after treatment. And what they found was pretty astonishing. The answer is, for those who might lose me on the science, CBD was shown to help in all 3 categories: callus formation, osteoblast proliferation, and increasing bone density, okay? But group A, what they found, these were the rats that received both THC and CBD. I'm going to read this right to you. The callus increased in the rats given CBD or THC compared to placebo. This means stimulation of endocannabinoid receptors, improved bone healing. They said CBD had significantly enhanced both the mechanical and structural properties of the bone. Group B, they found THC seemed to increase maximal force integrity of the bone, so the bone's inability to break. THC seemed to play a big role. CBD also did, not as much as THC. And then lastly, and I think this is the most exciting part of these findings, is group C. These were where they took the osteoblasts, the things that grow our bones, injected them with CBD or THC. What they found was not only did CBD help promote the activity, osteoblast activity, the release of this enzyme that lays down new collagen, but it was in the manner that CBD did it. And this is what I call getting to the root cause. It actually impacted the genetic makeup of that cell, making it release more enzyme to build more collagen. It affected the cell's RNA, which for all intents and purposes, people can think of as DNA. It impacted the genetics of the cell. So this is where I get down to what's the root cause of the problem, right? I hate to hear, oh, you have osteoporosis, you have low bone density. Let's just give you a drug that's going to increase bone density. Well, why? Is it your hormones that are low? Is it a genetic issue that's wrong? And we talk about CBD balancing the human body, balancing the body. And I think this is a prime example. And this is really the first study to show this, to demonstrate something to this level. Now, I know the next question usually from people is, oh, how much do I take? This is awesome. And this is a great time for me to make this point, and I hope all of our viewers and listeners, they take away something. This is so valuable because it applies to all of our podcasts. These studies were based on rats. They weren't based on people, unfortunately. So we can't say, oh, we gave the rat an injection of 0.5 milligrams CBD, and this is what we're going to do in humans. We don't have that information yet. But what we can say is this, and this is what I say. If you are planning on maybe taking this for prevention or supporting healthy bone health, I would tell you to monitor other things as well too. So maybe you are a female who's going through menopause and you have hot flashes. I would bet if your hot flashes start to improve, that means that you're taking the right amount for other physiological systems as well too, perhaps bone density. If your anxiety improves, if your sleep improves, that's the easiest way for me to know that a patient is on their way to that sweet spot dosage, which most people probably between 5 and 100 milligrams a day in this case. You can ask your physician to continually monitor. If you change nothing, but you incorporate, let's say, 40 milligrams of CBD a day into your lifestyle, you can ask your physician for those follow-up DEXA scans, and that's a way to monitor how it's working. But right now, again, I tell people that the studies that we have, they're animal models in Israel. So it's impossible to say for sure that at dose. But I know that's always a burning question. So,
well, I think that's fantastic advice. What we're stating is that CBD is showing great promise, not only for bone growth, but for a myriad of conditions and topics, and we're experiencing the results, right? So we hear at CBD BioCare, we hear constantly, oh, it's helping me sleep, it's helping me with pain, it's helping with anxiety. The list is so long. You, as a practicing chiropractor in New York, you're hearing the same thing. So we're sharing these stories and we're saying the research is very promising. The testimonials are very promising. But again, it's not FDA approved and there's so much that we still don't know. So I think your message is being heard loud and clear. And what I'm hearing and what I experience is, look, I'm going to take it because there are no risks to taking it, right? So
absolutely.
I'm going to see what my baseline, if you're watching this and you haven't started taking CBD, get your blood work done and find out what your baseline is. And then maybe get your blood work taken in 6 months. And then you can see how CBD, if that's the only thing that you've changed. But again, Dr. Frank is always talking about a holistic approach, right? If you improve your diet, you're taking CBD, you're starting to exercise, it's a holistic approach to healing and helping your body. And then if you're over the age of 50, you probably want to get a DEXA scan, that bone scan, so that you can see the composition of your bones so that you know if CBD is helping you. You're really your own experiment. Is that correct?
That is absolutely correct. And that's the easiest way to go about it. Again, I mentioned I had a personal experience with this. And my approach was simple. I had seen a rheumatologist, I had seen a neurologist, I had seen a host of different doctors, and one of them wanted to give me testosterone patches. The other one wanted me on some of the most commonly used medications for osteoporosis. And my problem was, well, why is my testosterone low? Why is this low? What can we do to fix this and get to that root cause? And that's where that holistic approach came in. And that's where I was able to kind of use myself and monitor some of these different points along the way. Is my DEXA improving? Is my blood work testosterone levels, are those increasing? And the answer was yes. I'll tell people that are listening, when you look at a holistic approach when it comes to bone health, eat healthy. One of the first things I did, eliminating a lot of the grains and the dairy products, was huge for me. Another really big thing, the weightlifting, get into weight-bearing exercise. That is a proven way of increasing bone density. So for whether you're female, male, get into weightlifting, not walking, weightlifting. Cutting out, if you do use tobacco products, cutting out on that. I would argue too, limiting yourself to 1 to 2 cocktails a week, perhaps even eliminating alcohol if you're really concerned, plays a huge role when it comes to osteoporosis and osteopenia. And then that testing, there's urinary tests that you can do to test for osteoporosis. There's DEXA scans. So that we take that whole body approach. And I really do think, though, for myself, CBD was the catalyst, because I can tell you, I was doing all those other things and I wasn't getting the same effects. When we added in the CBD, it was really an amazing thing. It was an amazing thing.
I love hearing that. I continuously get excited about CBD for a new reason on a regular basis. So it's exciting about all the potential that we're seeing with CBD. But I also want to mention something. Not all physicians are on the CBD bandwagon. It doesn't mean that CBD isn't a credible product. It just means that they haven't been educated. For example, my son 2 years ago broke his wrist. I'm going to an orthopedic physician. He was fantastic, very highly recommended. I mentioned CBD because every time I'm going in to get an x-ray, because they're constantly monitoring my son's growth to make sure he didn't need surgery because he is young. And he said, wow, it's just amazing how well his bone and his body is reacting. And I said, well, I'm also giving him CBD, and I stated some of the research. He literally, there was a blank look on his face that he's like,
Huh?
whatever's
Yeah.
working, but it's kind of one of those kooky mom moments where it's like, okay, whatever, you're feeding them, that's great.
Yeah. Lady gives son cannabis.
Yeah,
That's
exactly.
in the
But
chart.
right. But he didn't know anything about it. So I want to caution you. I want you to speak to your physician and include them, but don't let that be your only avenue of research. If your physician says or doesn't respond or says, oh, I don't know anything about that, this is what you need to take. Um, be a little bit more persistent. Do your own research,
That's so true.
because not all Western medicine physicians are educated about the benefits of cannabis. Just want to add that.
That is so true, and I hate to break it to people, they're not going to be until there's human clinical trials, which we could be years away from in the U.S. The reason why they don't comment is because it's in rats, because it's in this, and they don't want to say anything until it's in human clinical trials. Like, we know from these testimonials that it's working. We know that the risk is minimal, if not none. So you don't have much to lose here.
I love that. Okay, thanks, Dr. Frank. Have a great day.
Of course. Thank you.